We move now to Alzheimer's. Women are more likely to get the brain disease than men, a reality that Maria Shriver began making the country aware of more than a decade ago. The journalist and former First Lady of California founded the nonprofit Women's Alzheimer's Movement, or WAM, which raises funds for research. WAM held a forum in Las Vegas to announce some new research and honor leaders in women's health research and caregiving. This took place at the Ruvo Center for Brain Health, home of the WAM Prevention and Research Center, which Shriver says she convinced Camille and Larry Ruvo to open.
I'm so grateful to Camille and Larry, who jumped onto this idea 5 years ago when I said I want to do a prevention center. And everybody told me prevention and Alzheimer's don't belong in the same breath. But I knew that they were wrong because they had told me the same thing about women. And so usually when someone tells me I'm wrong, it just kind of makes me dig in even more. So I have 4 brothers, and so that's the way I've been rolling since birth.
Shriver is a well-known member of the Kennedy family. Her uncles on her mother's side included former President John F. Kennedy and former U.S. Attorney General Robert F. Kennedy. That makes Health and Human Services Secretary Robert F. Kennedy Jr. her cousin. As part of President Trump's efforts to reduce federal spending, RFK Jr. has canceled certain research funding and is proposing an $18 billion reduction to the National Institutes of Health budget. The NIH is one of the largest funders of medical research in the world, and as Shriver explained to Nevada Week, it's provided more than $83 million in additional funding to the 51 studies that WAM has funded.
These are seed grants that researchers, once they've done the initial research, they go to NIH to get additional funding. So that has been the path in the past, and I hope it will continue to be in the future, because Alzheimer's, women's health and research isn't a political issue. It's a national issue. It's a human rights issue, and I'm planning on it continuing. And so our work has been funded by regular people, everyday people, by corporations, by philanthropists. That's why we wanted to focus a light on those who have been supportive of us and who will continue to be supportive of us.
One of those people was Elaine Wynn.
Correct. And she was not only a dear friend, but she was a champion of women's health and research. She was a champion of the center and of our work. And when I called her several months ago and said, I really want to honor you for being a trailblazer in this space, she said, yes, I know how important that is, and I welcome being honored in that respect. And I'm so proud that we can continue to honor her in memoriam. I'm a big believer that people live on. She certainly will live on in this prevention center and in this nonprofit.
You and your son will also be honored.
Yeah, Mosh has been really a big partner for the Women's Alzheimer's Movement, and I hope it shows to people how important corporate support is when you're trying to make a difference in research. Mosh is a brain bar. It's a protein bar for the brain that Patrick and I started several years ago, and it shows, I hope, the importance of eating for brain health. What we put into our body either helps our brain or hurts our brain. And Mosh has been at the forefront. It's really successful. And one of my goals was that it would fund the research of the Women's Alzheimer's Movement. And it has already, to the tune of hundreds of thousands of dollars. And my hope is that it does it to millions of dollars. So it's in direct proportion to how people buy it, to the money that it can fund in research. But it's already funded grants and it will continue to do so.
So how cool that you've created this company that is directly funding a movement that you are so close to. Now, here is the issue, like you talked about, with funding being cut across the board for nonprofits. You have corporations and philanthropists who are now being asked by multiple organizations to give more. Mm-hmm. How do you confront that?
I think you just stay the course. And you look for different ways to find your funding. So you come up with your own bar company. You do more events like this. You shine a light. You hope that people see that women's health and research has been neglected, misunderstood, underfunded, and they want to rectify that. And we won't be able to make responsible, informed decisions about our health as women unless we have the research to guide us. And we haven't been given that, so we have to go out and get it.
There are a lot of family connections to this issue. It was your mother who, in a broad sense, opened your eyes to women's health, but then your father himself who suffered from Alzheimer's. What was it that was happening with him that made you think, this is what I want to dedicate myself to?
Well, it was my curiosity as a reporter that I was, wow, this is the smartest human being I know. This is a man whose brain created the Peace Corps, who came up with Head Start, who came up with Job Corps, who ran the war on poverty, who ran for president, who ran for vice president, and now doesn't know who I am. How does that happen to a brain, especially a brain this intelligent? So the more questions I asked, it led me down this path of realizing this wasn't a normal part of aging. This was something that we should all care about. It led me to learning about the brain. It led me to understanding that women's brains were under-researched. It led me to understanding that women's health was under-researched, underfunded. I'm a mother of 2 young women. I'm a woman myself. Every time I went into the doctor's office and I said, what about this or what about that? The doctor would say, we just don't know. We don't have the research. When I took a drug, a prescription drug, I'd say, has this been tested on women? I was told no. I was like, why is that? They're like, good question. No one's ever asked. No one's ever done anything about it. And so I thought, well, someone should do something about that. And then I thought, well, I'm capable of doing something about that. I should do something about that. So it brought together my mother's struggle with her health, the dismissal she felt as a woman when she tried to get answers for her health. It brought together my father's Alzheimer's diagnosis. It brought together my own gender and the inequity that I saw, what was happening to other women like myself. It brought my reporting to the forefront. So it was a perfect storm for me. And I saw an issue that people weren't championing. I saw something that could be rectified in my lifetime for my daughter's generation. And it galvanized me, it enraged me, and it motivated me.
Of the progress that you are responsible for in this area, what are you most proud of? What stands out?
Well, I'm proud of rewriting the narrative around Alzheimer's to put women front and center when everybody told me that that was incorrect. And when everybody told me that women weren't discriminated against. I'm proud of the work of the White House Initiative on Women's Health and Research. I'm proud of letting women know that they should care about their brain health and that there are things that they can do, that they can get in the driver's seat, that they can be philanthropists even if it's only $25. So I'm proud of that. I don't know that I'll find the answers I'm looking for in my lifetime, but I know that because of this work, when my daughters and their generation are my age, they'll get different answers in the doctor's office due to a lot of the work we're doing.
So you have a family member within the administration right now. RFK Jr. is your cousin. He is the Secretary of Health and Human Services. The progress that you've made, what role do you think he will have in continuing it?
Well, I know he's supportive of women's health and research, and I'm going to meet with him about it. And I think he should be asked that question by other people as well.
Will you be asking him that?
What do you think?
I do. I wish I could be a fly on the wall in that conversation. Yeah. Do you know when you'll be meeting with him?
I talk to him a lot about it, so I'll let people know.
Great. That's wonderful. You have already been vocal about the funding that was at threat of being cut. Initially cut, then restored. What did you say that you think got through?
Well, I think that, the Women's Health Initiative has been a complicated issue. I think people focus on it
Why is
because,
it
well, it was complicated, specifically regarding its findings on hormones, right? So, but it does a lot of other work, and I think sometimes people lose sight of that. They don't understand the complexity of women's health. So I think having a women's health and research initiative is integral to this country. Women are 50% of the country, and traditionally, NIH has spent about 10% of its budget way before this current administration. So this is has been a problem long before this administration, and it will continue to be an issue until it's of equitable distribution, until 50% of NIH's budget is spent on women's health. And so I think women's health has been siphoned. I know when I go to corporations, they say, well, we support breast cancer. I said, but there's more to women's health. Or people say to me, well, you're talking only about reproductive health. I said, no, I'm talking about women's health. So that starts in puberty. It goes into your reproductive years. It goes into perimenopause. It goes into menopause. It involves autoimmune. It involves MS. It involves Alzheimer's. It involves osteoporosis. It involves aging. And then people step back and go like, oh, wow, I never thought about it like that. And we need, as a nation, to get better educated. Medical schools need to do a better job. I was just talking to Mary Claire Haver, who's going to talk today about menopause, and she said, I never was taught to associate menopause with brain health. That's in the past. We've got to change that. And so political figures have a role, funders have a role, and so do everyday women have a role.
Who does this forum serve?
This forum serves every single woman in this country. As I said, if you have a brain, you should be thinking about Alzheimer's. Not if you have the gene, if you have a brain. Because we don't know who and why, right? We know it discriminates against women, women of color, women of Latino descent, and we know now that there are things that each and every one of us can do. You can start eating for your brain right now. You can start moving for your brain right now. You can start sleeping for your brain right now. You can start thinking and prioritizing your brain health as soon as you hear this.
The other side to this are caregivers.
Sure.
What do they lack that you wish
Everything.
they could have? If you could pick one to two, snap your fingers, this is what
I think they
get.
lack the dignity, the awareness of what actually is involved in caregiving. For every diagnosis of Alzheimer's, there's a caregiver who's going to have to step up.
They lack dignity? They don't get the dignity?
Absolutely. I don't think people, pay caregivers what they deserve. They don't put them on the cover of Fortune magazine or Forbes and say, look at this caregiver. For sure not. And the majority of caregivers are unpaid. So we need to make it a profession that people will want to go into, that it's well paid, that's actually a profession that people can, survive on.
What about for caregivers who are family members and they do not qualify for Medicaid to get paid that way?
Well, we have to change it. As I said, we have to dignify what they're doing. We have to be willing to listen to what they're doing, hear their stories, offer them support, encourage them to take time for themselves. It's a 24-hour job. So I think, everybody, as I say to my kids' generation, you're the caregivers on deck. You want your parents to be as healthy for as long as possible, because who's going to care for them? Who's going to pay for that care? This is going to end up in your lap. So the more you care about how they age, the better. We need to have a national conversation about aging in our country. This is an aging country. What does that mean for corporate America? What does that mean for our cities? What does that mean for Medicare, Medicaid? What does that mean for the healthcare industry? What does that mean for nursing homes?
What about, though, someone sitting at home saying, you know what, we have a huge national debt. We need to cut this kind of funding. It's just got to happen.
Do I don't hear anybody saying that, actually. I hear that, people say we need to cut waste out of the federal government, and that's a worthwhile conversation, just like every family probably needs to cut waste.
Is there waste, do you think, within funding for research?
I've not seen that, no. And I think certainly there's no waste in the research that WHAM is doing. There's no waste in the research that the Cleveland Clinic is doing. I think,
it's so vital that's
people come up.
funded.
Yeah, but I think, there's national research that I think people can collaborate on. I'm sure there are ways to figure out, okay, how can we speak to this moment where people want to see more collaboration. They want to see more sharing of information. So do I think that can be done differently? Yes. Can that be more helpful in the medical field of research? Yes, that's a good place to look at. How can people work together, share their results? What is the role of AI and that sort of thing? But I haven't met anybody who comes up to me, and people come up to me now every single day. If I'm getting a coffee, they come up to me and say, I need a diagnosis for my parent. I need a doctor for my parent. I can't get into a neurologist for my parent. Where can I take my parent? How do I do this? Every single day. No one's ever come up to me and said, yay, let's cut Alzheimer's research, or bad on you for advocating for women's health and research. They come up to me and say pretty much everything and anything, and all kinds of things have been said to me in my life. That has never been said to me.
Last thing, with your many years of dealing with lawmakers, what is it that they're missing in this conversation?
So I think it's finding, the will. It's finding the focus, because there's so much going on. It's being able to, as I always say in my Sunday paper, rise above the noise and just take a minute. I myself have to do that when people are like, what are you going to do? But, there's a lot of panic, I think, out in the zeitgeist. And I think being able to urge people like, wait a minute, that hasn't been cut yet. Let's stay focused. Let's just, take a breath. I think that's important in life. And so I am very committed to working across the aisle. This is not a political issue. It's a human issue. I care for a woman who's of a different political party, who gets breast cancer, who has a heart attack, who has osteoporosis, who has anxiety or depression. It's human beings. I mean, for God's sake, can't we agree on that?
Maria Shriver, thank you so much for joining Nevada Week.
Thank you.
Nevada has one of the fastest growing Alzheimer's populations in the country. According to the Alzheimer's Association, there are 55,000 people in Nevada living with Alzheimer's, which results in 146 million hours of unpaid care provided by caregivers. The brain disease also costs the state's Medicaid program $300 million a year.